Today's research theme 4 focuses on the article A 2010, which portrays a model for chronic care. That means for patients suffering from chronic health conditions, what kind of a healthcare model should be applicable or should be implemented in order to provide an effective treatment for these patients suffering from chronic health conditions. So, this model encompasses around 5 to 6 factors. One is community, second is the health system, obviously, then the delivery system design, decision support, and clinical information system, and along with self management support. So, what they try to present here is that uh, if treating patients with chronic conditions or long term conditions, community should provide the resources, the policies, because in terms of monetary or infrastructure there should be well established resources provided, and in terms of health system, an organization of health care should obviously be available in order to treat the patients. You can't just treat it under a simple four-walled house. A decision support system, because there should be physicians involved, consultants involved, healthcare workers involved to make timely decisions as to what kind of treatment that should be followed, or even any modifications that should be done for the drugs, the dosages, and even clinical information system should be available, because every now and then there can be various support systems, various biological parameters that would keep varying the patient. So those can be done by laboratory investigations like biochemical investigations, clinical serological investigations. So all these have to be on a real time, it has to be updated in the clinical information system, and based on that a decision would be made, and thereby appropriate and effective treatment would be noted. So, and not just the decision making, it should be delivered on time in the correct way. Maybe the route of administration has to be correctly done, the dosage regime has to be followed, and even certain self management support should be made available to the patient so that their psychological, social factors are also well supportive to receive the healthcare. So, having this model in practice, the patient can be an informed, activated patient, and there can be a prepared, proactive team who will help these patients to uh, interact with these patients and obtain an improved outcome of their particular disease condition. So, this is what the chronic care model of 2010 A 2010 study suggests.